Evening. So it's been a while since we've had a chat, really, and I thought I'd just touch base and say hello. A&E's been really busy at the moment, but it's definitely calming down after the winter rush, I suppose. Um, One of the things that I noticed in today's shift was how many people are involved with just one patient's care, and I thought I'd just sort of try and highlight that a bit. So you've got your patient, they come in, and first of all, they've been brought in by a London ambulance crew often. So that's the first part of the team. And then they're received by the sister in charge who admits the patient onto the system. And then that patient goes on to see most likely one of the triage nurses. And they will take bloods, do a ECG, so tracing of your heart, observations like your heart rate, blood pressure, and oxygen levels and breathing rate. And then the patient might be seen by a doctor who will initially assess them and work out what investigations they need. And then a porter will come along, and the porter will often take them off to go and have an x-ray. So they're met by a radiographer, and the radiographer does the imaging that they're required, and a radiologist, so that's a doctor trained in looking at the images, reports on them. They come back to their bay in the A&E department, and then they have a set of bloods taken, and they go up to the biochemistry, and the lab technicians then analyse those blood tests. Those blood tests then get sent back to the doctor, who makes his decisions, or her decisions. Then the decision is made as to what other treatments are needed. That might require specialist input from other doctors or units. If it's an elderly patient, for example, they might also need occupational therapy input, physiotherapy, or dietitian input. And then you've got to think about planning that patient's discharge, and that may require a social worker or a care coordinator who then helps to arrange the appropriate support that's at home. Then you've got to get the patient home, and that requires transport staff, and they will get the patient home, and then the patient has ongoing care in the community. Now, I haven't touched on so many members of the team that are involved or can be involved. For example, dietitians, catering staff who come around and offer the patients tea, volunteer workers. We talked about social workers, so many members of the team, family, it's all involved. So it's such a complex beast, A&E, and there are so many people involved. And, I think it's really incredible when you actually sit down and write down on paper how many people are involved in just one person's care. So I guess it's food for thought. But another good shift. I got one more month in A&E. And then I move on. So I'll keep you updated.